JD Vance has gone from hillbilly to senator to VP candidate pretty darn quickly. Well, what are his views on healthcare, and what do they mean for the country, especially if he's one heartbeat from the presidency? This episode of CareTalk is brought to you by Matrix Medical Network. Matrix Medical Network pioneered the first national in-home clinical network nearly 25 years ago, and today is an independent provider of in-home health assessments serving people across the nation. The company's national network of nearly 3,000 clinicians delivers comprehensive, personalized care for Medicare Advantage, managed Medicaid, and commercial patients across all 50 states. Care visits include diagnostic testing, risk identification, medication management, and tailored lifestyle improvement plans. Welcome to CareTalk, America's home for incisive debate about healthcare, business, and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, senior advisor at Walgreens.
Well, join the fast-growing CareTalk community on LinkedIn, where you can dig deep into healthcare, business, and policy topics, access CareTalk content, and interact with the hosts and our guests. I don't think you can interact with JD Vance there, but who knows? Please be sure to leave us a rating on Apple or Spotify while you're at it.
So, David, talk to me a little bit about who is JD Vance?
Well, JD Vance came to people's attention as the author of Hillbilly Elegy, John. He grew up in the hillbilly region and was a kind of an interpreter that people could say, let me understand all these Trump voters. And so that's how he came to fame. And then he got some famous people interested in him. He ended up being a senator, and now he's VP. I understand he's a very flexible guy, John, on policy.
Well, JD Vance, combat veteran, Yale grad, grew up in Appalachia, and almost remarkably through a battlefield conversion to Trumpism and MAGA, gained Trump's endorsement, elected to the Senate. I think, David, he's only been in the Senate. He's only been in electoral office for 18 months.
Yeah.
He's how do we think he might influence healthcare policy?
Well, John, we have one Trump administration to look back on with fondness or not. And one of the things that we saw there was that Mike Pence, who was the vice president at the time, had a significant impact on healthcare policy. I don't think Trump gives a rat's you-know-what about policy. And so he lets other people deal with it. Vice president in that case, picked people from his home state of Indiana, Alex Azar and Seema Verma, two top people in healthcare. So I think that Vance could certainly have a big role. And then the question is, what's that role going to be?
Well, and Vance at least has a record in being radically against gender-affirming care after he was apparently for gender-affirming care for one of his colleagues based on one of his classmates' recently released texts. He was, I think, for women's right to choose with some restrictions. Now he's completely against women's right to choose. So when you talk about flexibility, we're talking about flexibility in the extreme around at least healthcare policy for prospective vice presidential nominee and vice presidential candidate Vance.
Sure, John. And I think especially, given how old the Republican nominee will be when he takes office, if he were to take office, is that there's a pretty high likelihood that the vice president would end up actually serving. So it's not like somebody changed their view, John, if they like purple today and yellow tomorrow, or vanilla ice cream one day and chocolate the next. This could matter, if when it comes to things like abortion, where he's been sometimes very, very strict, including, without an exception to say, hey, rape, incest, that doesn't really matter. The circumstances, it's why should the child be, deprived the right to be out in the world? I mean, if that's the view, that has some pretty radical implications. Now, he's
just to be clear, he I think was for abortion and the women's right to choose with some exceptions. Then he went to an extreme position, I think, assuming that that's where MAGA and Trump were. He didn't check with President Trump because President Trump does not actually agree with that position of banning abortion without any exceptions, including rape and incest. And so now he is back to sort of a moderated position. I think that the challenge in thinking about an 18-month senator who started as a moderate, ran against Trump as unfit, then embraced him, then ran ahead of him, and now is running back. It's going to be really hard to pin him down, David.
Well, John, what I'm looking forward to actually is, this isn't exactly healthcare policy, but we could make a bet, John, on whether Trump will turn on him publicly and blame him perhaps even before the election for whatever mishaps he may encounter.
Well, I think that the thing we need to monitor is exactly what you said about Trump, that, for example, whether it was COVID or drug prices or anything related to healthcare, he tended to delegate and then disappear as a president with regard to healthcare policy and issues. And we're going to have to look very carefully if he becomes as he develops his policies and articulates them as a nominee, where, again, it's unclear where Trump stands between Project 2025, the Heritage Foundation's rather extreme conservative view, or his own somewhat creative policy creation on the fly. Where that lands, what we really have to do is look at the people around him and who's advising him in order to determine where healthcare policy might go.
Let's look at a couple of things that he's actually done in the Senate in that brief time frame. Yeah, it's interesting that he's not the only one to have served a short term in the Senate and then run for higher office. President Obama also was a first-term senator when he ran. Now, of course, his previous job had been as a constitutional law professor, so he knew something about the Constitution and so on, and perhaps Vance does as well. On immigrant care, Vance is a proud sponsor of a bill to deny coverage to DACA recipients. Those are the people that are the deferred action who are here in the U.S. under this this sort of temporary status. The DACA recipients are mostly people that were brought here early on as children, and there's 700,000 or so that don't have a clear right to be in the U.S. Now, they have been able to get health care coverage in some cases. And there's an explicit bill to say, let's actually take people off of that coverage, which is about 700,000 people. It's just economically stupid, John, among other things. Farmer pricing is a topic we discuss a lot here on the show. And, he was supportive of price negotiation in 2022, but he's actually since backed off on that. He probably actually fits with Trump there, who in his first term of office did talk about negotiating and taking in sort of the lowest international price that was offered. And then, John, opioids. Where does opioids fit in to Vance, both from a personal standpoint and from a policy standpoint?
Well, I think in the case of opioids, a lot of the hillbilly elegy goes into the examples of how many people in the poorer parts of Appalachia that he grew up in are addicted to opioids, including his mother, who's now been clean for a number of years. So I think that where issues really come close to him personally, he actually, I think, is more articulate about what can and should happen. I mean, certainly the derailment in East Palestine and the poisoning that happened and the healthcare risks that happened, he can react pretty quickly, and I think from the heart on issues that touch him personally. Other than that, I think it's sort of whatever happens to be coming out of Trump's mouth. I mean, the reason why I think he was chosen was alignment and aggressive alignment with whatever Trump's MAGA agenda was at the time. I think that flexibility may get him into trouble, and we may be in a situation where, given how challenged his popularity is nationally, you might be right. There may be another nominee coming because he doesn't really have a grounded base or a clear set of policy points that he's stuck to.
Well, let's say for sure that Trump wouldn't have picked him if he knew that he was going to be running against Kamala Harris. Maybe we'll end just by a little bit more about this train derailment, picking up on your point, John, that that he's personally involved with, he has some coherence. So there was this derailment. People were poisoned, as you say, and he's pushed for more benefits for victims, including a bigger settlement. And interestingly, he's pushed for the implementation of what they call an obscure provision of the Affordable Care Act, which, as a Republican, he would generally be against, which can provide Medicare benefits to those that are exposed to these sort of dangers. And God forbid he wants more supervision of the rail industry, which I don't think is going to get him anywhere too fast in the grand old party.
No, indeed. The largest individual giver is a guy named a reclusive billionaire named Timothy Mellon, who has who has gotten into all kinds of trouble by running a railroad that eventually sold that broke a number of many of the rules and regulations that JD Vance actually wants to enforce. Again, there's a little bit of, he could run into some challenges on consistency there too, David, but I think we'll have to just watch how this emerges and maybe return to it as a hot topic on where does JD Vance stand today and where's he going to stand tomorrow?
Well, I'm worried he might be standing right in the middle of the track, John. Choo choo. And I don't know whether the train is going to stop for him. Well, that's it for yet another episode of CareTalk. We've been speaking today about JD Vance, current candidate for Vice President of the United States of America. I'm David Williams, President of Health Business Group.
And I'm John Driscoll, Senior Advisor at Walgreens. If you like what you heard or you didn't, please subscribe on your favorite service.